Hello, my name is Andrew Beal. I'm the author of Trail Guide to the Body, and I want to welcome you to the wonderful world of palpation. Imagine being able to feel the difference between the biceps brachii and the brachialis muscle. What if you could confidently locate the second rib, or isolate the piriformis to relieve a patient's sciatica pain? Well, if those sound appealing, you've come to the right place. There are three aspects of palpation. First, locating a structure. Second, becoming aware of its characteristics. And third, assessing its quality or condition so you can determine how to treat it. This presentation highlights those first two, the location and characteristics of structures. And although we'll discover many things along our way, we'll focus on the major muscles of the body. Now, the question arises, just how important are palpation skills anyway? Well, I think it's hard to overstate. And that's because for a manual therapist, palpation is like the ABCs, essential building blocks. But unlike the rote learning of spelling, palpation is a continual journey of discovery where each and every body deepens your kinesthetic skills. Now, like the alphabet, the power of palpation is in its application. Whether you practice or are hoping to practice Swedish massage, physical therapy, acupuncture, any one of a number of other modalities, having a solid foundation of palpatory anatomy skills will bring a vital precision and effectiveness to your work. It's that simple. This presentation is a companion piece to the Trail Guide to the Body text. And if I had my way, it'd be about 40 hours in length. But we don't have that kind of time, and I suspect you wouldn't even have that sort of patience. But don't worry. The art and skill of palpation develop through multiple experiences and comparisons. And after you watch this presentation a few times, I encourage you to do just that. Experience and compare on many different people. Exploring one deltoid muscle, nice job. 100 deltoids, well, now you're really talking. So what we've given you here is an introduction, and we'll focus on 5 aspects of the major muscles of the body. First, how to position your partner and have the muscle engage or contract. Second, the key bony landmarks that isolate the muscle and its attachment sites. Third, how to palpate it, get your hands on it, and feel its texture and fiber direction. Fourth, how to differentiate the muscle from surrounding muscles and structures. And fifth, how to shorten and lengthen the muscle. So before we begin, how about a few palpation tips? First of all, allow your hands and fingers to be soft and responsive. Secondly, as you begin exploring, you may periodically want to close your eyes just to enhance your awareness. Smaller structures can be best accessed with a fingertip or two, whereas larger structures are best accessed with your whole hand. As you begin exploring the body, you may find that structures don't come into your fingers as readily as you might like. And a common response is to start pressing harder and deeper into the body. Well, instead of pressing into the tissue, try inviting the tissues into your hands. Gentle contact will allow your fingers to be receptive, whereas excessive pressure just numbs out the digits and makes for a generally uncomfortable experience for your partner. Ow! You may also consider first locating a structure on your own body before palpating it on your partner. Now here's an important one. Have patience with your learning process. Look, just because you've had a trapezius muscle your entire life doesn't mean you're going to be able to instantly locate it and explore it on your partner. Now, it's okay if you get lost, make a wrong turn on the body. Chances are you're very close to what you're looking for. Last but not least, when in doubt, ask the body. When you begin palpating, you may be a little confused or overwhelmed about the structures you're trying to find, but when in doubt, go ahead and ask the body that you're trying to access. For example, I could ask the question, what tendon is this that I see right here on the top of the foot? Well, that leads to the question, where does it go to and from? So if I follow it, it seems to lead here to the hallucis, or big toe. And if I follow it the opposite direction, it seems to pass along the top of the foot and then disappear here at the top of the ankle. Okay, well, what if I ask my partner to flex his toes? Go ahead and curl your toes under. Does that do anything? Not really. And if you go ahead and extend your toes, go the other way, well, wow, now the tendon really becomes taut and very visible. And I've just deduced, just by asking those questions, that that tendon is the tendon of the extensor hallucis longus muscle. That's the long muscle that extends the hallucis, or big toe. So always remember that you're never alone. The body is just waiting to help you.